News channel. Remember that Morning Live is still coming to you live from Klerksdorp at the city of Matlosana municipality under the Dr. Kenneth Kaunda district municipality. So we do know that during election times you get politicians making promises to the people on the ground in order to secure their votes. One of the promises that are usually made is that of improved health services. So let us talk some health issues here this morning at Matlosana. We're speaking to Thabo Pelefane. He is a national TB ambassador who is based here in Klerksdorp. Thabo, good morning to you and welcome to Morning Live.
Morning, and thank you for having me.
Okay, now you have to bend a little bit because I'm not your height. Well, tell us about the being an ambassador, a TB ambassador. What does it entail?
Okay, basically I was identified as an ambassador due to the fact that I have survived TB 5 times. So I've cured completely, so it makes it easy for me to can relate my story to others who haven't had it before or who are also at the risk of having TB.
So you survived it 5 times?
Yes, from 1989, at the age of 13, I had my first TB exposure, so it came back again, but the last time was in 2008.
But how is the prevalence of TB here in Matlosana, specifically here in Klerksdorp?
Well, currently we are a TB hotspot in the country. Based on the statistics that were issued by the Minister of Health, Dr. Aaron Motsoaledi, we are, as a district, we are at number 2 spot within the country. So it clearly says that there's a lot that needs to be done to get it cured.
But why is the situation so bad? Is it perhaps maybe lack of education to the community members? Because at times people are not even aware that they do have TB.
Yes, remember as Matlosana, we also one of the mining areas, and it has reflected that most of the mining areas, including Velkom as number 1, and in the province we have 2 mining areas. Rustenburg, it's also at top 6 of TB within the country. So there's an issue of stigma. People are also reluctant to go and test because of fear of rejection by either colleagues or family members.
But how do you go about, instilling that education, just to make them feel that it's not bad to have TB? I mean, it's curable.
That's why we come in as ambassadors, myself, the likes of Gary Elson, Thembi Siete, and Jimmy Tau, because of the influence that we have in the society. We share, we motivate and encourage them that TB, it's curable. TB, if you take your medication over a period of 6 months, you can cure completely and be better after that.
Okay. Now, you're not just a TB ambassador, but you also run an NGO which is doing a beautiful job, because you're also telling me that you have a gala dinner tonight. Is it tonight? Tomorrow. You have a gala dinner tomorrow whereby you're trying to raise funds for bursaries for the matriculants. Tell us about the NGO specifically as to what you focus on.
Okay, the name of the NGO is Thabo Pelefane Foundation. We started in 2012, and then last year what we did, we had a gala dinner once more at Rio Casino, in which we were able to collect 52 school uniform for learners within our area, especially in farm schools. We also had over 100 blankets that we collected and food parcels. A month ago, we partnered with the Nelson Mandela Foundation and Imbumba Foundation, where we gave 10,000 girls sanitary towels so that we can help them not to skip schools. Now tomorrow what we're doing a gala dinner at Rio once more. It's a sponsored venue which they have been very kind to us. What we intend to do is to raise funds to be able to allow learners who are unable to access higher education in 2017 so that we could be able to come of assistance based on the outcome of fees must fall in 2015.
Okay, but the response of the community around Klerksdorp in terms of supporting your NGO, because surely you're doing a great job, you're looking at the socio-economic issues, you're trying to address those. Are they really behind you, or there's still room for improvement in terms of the community coming on board?
I must say well done to the people of Matlosana. They've always been supportive. On the 21st of March, we had a fun walk making awareness of TB, and it was well supported. We have been getting enormous support from government, from the local business people, not all of them, but we still a new foundation, but we believe as time goes on, with our profile growing, partnering with bigger institutions, we would be able to convince more people to get involved in our activities. But the support is enormous, and I must say thank you to everyone who have been giving us that support.
Well, although standing next to you, you're really making me feel short. Thank you very much, Ralebo.
I thank you very much for having me, and I believe that what you're doing is a very wonderful job for sharing information with the people. Thank you.
Well, Raleboha, there you have it. That's Thabo Pelefane talking to us about the prevalence of tuberculosis here in Klerksdorp in the Matlosana region and what his NGO does in terms of developing the society where he lives here in Klerksdorp. Well, we're taking a break. Stay tuned. There's still more.